Sinus infections and allergies, often confused due to their similar nasal symptoms, are two distinct ailments with different causes and management approaches. A sinus infection, or sinusitis, typically manifests with symptoms like facial pain or pressure, thick green or yellow nasal discharge, and reduced sense of smell, often following a cold or flu. In contrast, allergies are characterized by itchy eyes, sneezing, clear nasal discharge, and often intensify in specific environments or seasons. Treatment for sinus infections may include antibiotics if it is bacterial, decongestants, and nasal sprays, while allergies are usually managed with antihistamines, nasal corticosteroids, and avoiding known allergens. Factors such as a weakened immune system and structural nasal problems may predispose individuals to sinus infections, while a family history of allergies or exposure to allergens like pollen can increase the risk of allergic reactions. Here's a detailed comparison of sinus infection versus allergies, providing insight into each condition's unique aspects. Affected tissues, mucosal lining versus systemic response. Sinus infections, sinusitis, typically inflame the mucosal lining within the nasal passages and sinuses, leading to symptoms such as pain, pressure, nasal congestion, and purulent nasal discharge. This localized reaction primarily occurs due to bacterial or viral infections that overwhelm the sinus cavities, potentially causing a secondary bacterial infection after a viral upper respiratory infection. Conversely, allergies trigger a systemic immune response to normally harmless substances like pollen or dust mites. This process involves the release of histamines and other chemicals throughout the body, causing a broader set of symptoms: sneezing, itching, and watery eyes, in addition to nasal congestion. While both afflictions can produce overlapping symptoms, treatments tend to differ, with antibiotics possibly being necessary for a bacterial sinus infection and antihistamines or corticosteroids being standard for allergic reactions. Immune activation, pathogenic invasion versus allergen hypersensitivity. When differentiating between sinus infections and allergies, understanding the immune response is crucial. Sinus infections, or sinusitis, often result from bacterial or viral invasions that trigger inflammation and swelling of the sinus cavities, accompanied by pain, fever, and purulent nasal discharge. In contrast, allergies stem from an inappropriate immune reaction to harmless substances like pollen or dust. The body responds to these allergens by releasing histamines, which cause symptoms like sneezing, itching, and runny nose, but without the presence of infection-induced fever. Treatment for sinus infections might include antibiotics if bacterial, while allergies are typically managed with antihistamines or nasal corticosteroids to control the immune hypersensitivity. Symptom onset, acute versus seasonal chronic. Distinguishing between a sinus infection and allergies can be perplexing due to overlapping symptoms like nasal congestion and sinus pressure. Symptom onset plays a crucial role. Sinus infections often present themselves abruptly following a cold or other respiratory infection and are characterized by pain, fever, and thick, discolored nasal discharge. Allergies, on the other hand, tend to have a seasonal or chronic pattern, closely tied to exposure to allergens. Symptoms such as itchy eyes, sneezing, and clear nasal discharge are more indicative of allergies. The seasonal recurrence and the response to antihistamines further hint at allergies as opposed to the isolated episodes of sinus infections, which may require antibiotics. Understanding the timing and triggers of symptoms is key to an accurate diagnosis and appropriate treatment. Primary irritants, bacterial, viral versus environmental. Distinguishing between sinus infections and allergies is crucial, since their primary irritants significantly impact treatment. Sinus infections, typically triggered by bacterial or viral agents, initiate a localized inflammatory response in the nasal passages, leading to symptoms like fever, thick discolored nasal discharge, and facial pain. In contrast, allergies are immune responses to environmental allergens like pollen, dust, or pet dander. These allergens don't cause infection but lead to an overreaction of the immune system, causing sneezing, itchy eyes, and a runny nose with clear mucus. Understanding the underlying causes is essential for an effective remedy. Antibiotics may be necessary for a bacterial sinus infection, whereas antihistamines or other allergy treatments target the allergic reactions. Prompt and accurate identification of these irritants guides appropriate medical intervention, alleviating symptoms by addressing the correct source of discomfort. Treatment approach: antibiotics, antiviral versus antihistamines, allergen avoidance. Sinus infections, sinusitis, often require antibiotics if they are bacterial, as viruses causing sinusitis typically resolve without specific medical treatment. On the other hand, allergies, which are immune responses to foreign substances, are managed with antihistamines that reduce allergic symptoms and by avoiding the triggering allergens. Allergies can often lead to chronic problems if not managed correctly, while untreated bacterial sinus infections can result in complications. Both conditions may present similarly with nasal congestion and discomfort, but the treatment strategies are distinct, emphasizing the importance of an accurate diagnosis to initiate appropriate therapy and achieve symptomatic relief.